Hello, I'm Dr. Depesh Navsaria. I'm a pediatrician in Madison, Wisconsin, who does a lot of work in public health and out. I'm an associate professor of pediatrics at the University of Wisconsin School of Medicine and Public Health. We are re-recording this presentation that was done live yesterday on COVID-19, safety tips for reopening your library. We had some audio issues, and also a lot of people weren't able to join in, so we decided we would re-record this in a cleaner format so everyone can benefit from this advice. So thank you for rejoining us whenever you're watching this. My thanks to the folks at Demco for all their assistance and technical support and patience with getting this all together. This was very clearly a very popular topic. So with that, let me get rolling here. I am, besides being a professor of pediatrics, I also do have a library degree. I did go to library school, and mostly for children's literature, but I feel a strong kinship with school, public, and other libraries wherever they may be. The libraries offer a really important resource for our communities in many different ways, and I'm so pleased to be able to share some information and advice with you today. So let me start with some opening thoughts about COVID-19 and libraries, just to kind of frame this overall. First of all, I want to be really clear that nothing that I say on this overrides what the Centers for Disease Control or state and local health authorities may say, all right? They take precedence. This is a fast-moving issue, and also not everything is same in every location in our country, and certainly even the world. So please do recognize that if you're hearing conflicting advice or approaches or thoughts, please listen to your local. They know your area as well as anyone, and they should take precedence. So really, don't say some guy on a webinar said this, we should do this instead. It's okay to have discussion, ask for clarification, and so on, but again, they take precedence. Next, there's a lot that we know about COVID-19. There's also a lot that we don't know. So this is really important to recognize, because sometimes there's a feeling that, oh, we don't know anything about this, there's so much unknown. Actually, we know an awful lot. But at the same time, there's a lot of specifics that we don't have the answer to because the research hasn't been completed yet. We just don't have enough time, enough effort yet put into absolutely everything in a relatively short period of time. So the important thing here is that I need everyone to be comfortable that there's some level of uncertainty and lean into that. We're living this in healthcare on a daily basis. I'm getting asked questions. I go to our local juvenile detention here in Dane County, and we're wrestling with all these questions. I'm also a camp physician. We're wrestling with all these questions. I feel the level of uncertainty that you have. I'm experiencing it as well. We need to kind of roll with it and say, this is what we have. Sometimes we need to go with the information we have than the information that we wish we had, hoping that, of course, that will change later. And finally, what we know is changing very quickly. There's a lot of different things out there, new information and so on. It's also really important that we think about the reliability of that information when we do see something new, and not just say, oh no, there's this thing here, we need to do that instead. Because this is important for not just us as professionals talking about how we open libraries, but also the communities that we serve, the public, schools, etc. We need to stick to well-vetted, reputable sources and not chase the bright new shiny object of the news. There's a lot of really bad takes there, often sometimes reported in mainstream media. Headlines can be very deceptive, and also it can offer kind of this sense of certainty. Well, the public may not recognize, and we may not recognize, wait a minute, this thing that we're looking at, that's a preprint that's not even peer reviewed on some website. You know, it may be meaningless. Or this is a computer model that someone put together, but it's not actually a study of what happens in the real world, which we know are two very different things. So this is actually an interesting opportunity for us to practice and to teach information literacy to the extent possible. Next, recognizing for yourself as well as for others. No human activity of any kind is ever 100% safe. I think that's really important to remind yourself, right? Sometimes families will ask me, what really is the risk of my child being immunized, you know, against influenza or whatever? What's the most risky thing? How risky is it? And I often somewhat tongue-in-cheek say, well, your greatest risk is actually getting in the car driving to the clinic to get the flu vaccine, right? You're much more likely to get injured in a car accident than you are from receiving vaccine, right? We need to contextualize these things and recognize that there's risks to doing anything, including remaining in your home forever. So if anyone ever says, well, we need this to be absolutely 100% safe, okay, that's a great goal to move towards, but let's also recognize that that's not a realistic place to arrive at some point. And finally, most importantly, we need to be calm, we need to be caring, and we need to be confident in how we comprehend this whole issue and be compassionate for everyone around us, because that's going to take us a long, long way. There's a lot of fear, there's a lot of anxiety, there's a lot of worry, there's a lot of sense of loss for everyone really around everything that's happening. And so we really need to recognize that. Many more people are being affected by the psychosocial implications of this disease than the actual disease itself. And this is not to downplay how awful this virus can be if you get it, and about the need for ICU care and so on. Far from it. But what I'm saying is that there's a number of people who are being affected by this, and then there's an even vast number in the efforts to try to make sure we're protecting everyone that are also being affected. So we need to recognize that this sort of messaging, information literacy, all that makes a really, really big difference. And honestly, this is where we need you. This is where we need librarians. Okay, again, I went to library school. I love what I learned there. I love what libraries do. I love what librarians think, and I love the way you think. And we need your talent to be able to make sure that in this era where this anyone almost can publish a really bad take, putting utter nonsense, we need you to help kind of say, let's all come down. Here's why we wouldn't necessarily put a lot into that at this time. Here's how you can understand a good source from a not so good source. Here's how you can evaluate these things. And if you'll indulge me for just one moment, I'm reminded often in this time of Dante's Divine Comedy, where Dante, the Italian author, is descending into hell, going through the circles of hell. And the person accompanying him in this painting by Delacroix is Virgil, the Roman poet. And you can see Dante there on the left. He's wearing the red, almost a face covering, ironically. And he's just horrified at what he's seeing around him in hell here, right? But Virgil's with him. We need to be their guide. We need to be their Virgils, right? We need to be there with them to say, this is what you're seeing. This is how to understand it to the extent you can, or that we know, or whatever is possible. And you notice what Virgil's doing. He's holding his hand, right? We need to hold the hand, all of us professionals, whether it's librarians or physicians or nurses or early childhood professionals or teachers or whoever out there, right? This is one of the most important things we can do besides the actual factual information itself, is to teach people how to think about the information and how to interpret it in a reasonable way. So thank you. Thank you for all those things that you do. All right, let's get into the meat of this here. Some big concepts to know. First of all, the virus itself is known as SARS, Severe Acute Respiratory Syndrome, CoV, which is coronavirus 2. The first one is the thing that caused the disease we call SARS from several years ago. The disease itself is known as COVID-19. So you'll see these two terms used interchangeably, but the first part is the virus, the second part is the disease. However, almost everyone's calling it COVID-19. It's absolutely fine, but just so you know what the difference is. This is a highly infectious respiratory virus. There are a ton of viruses out there. Seasonal coronavirus, which is regular old coronavirus, I guarantee every single person listening to this, myself included, has been infected by probably more than once in our lifetime. It causes essentially a cold. There's also rhinovirus and adenovirus and human metapneumovirus and respiratory syncytial virus. These are all respiratory viruses. They spread. The vast majority of them cause anything from a mild or no symptoms at all to a severe cold. But that's about a ton more in the overwhelming majority of people. things are highly infectious, as you'll see. This is why we know so much about how to deal with COVID-19 already, is because we've been dealing with respiratory viruses forever, and we have a lot of good science on it. However, this particular one kills more people than most other respiratory viruses. I say most because in other outbreaks, but those are not actively circulating, whereas this is. It has a much higher mortality rate. It kills more people. That's why we're worried so much about this. This is the big deal right here. This is not merely the flu. And but influenza does kill a lot of people in the United States every single year. We just don't have Brussels headlines about it, et cetera, as much. It happens every single year, and people are stunned when I point out that influenza is actually a killer of quite a few children in the United States, actually, every year, numbering in the hundreds, depending on the year. So do keep that in mind. How does it spread? It spreads via physical contact with people who are contaminated or infected. Little distinction there. Infected means that the virus is in your body, it is in your cells, it is reproducing in the cells of the respiratory tract in this case, and then more them, shedding it. Contaminated, you may not be infected, but you may have it on you in some way. We'll talk about that in a moment. So how does that happen? How does that spread? Well, it's through surfaces. So it's through direct contact, right? Handshakes, high fives, hugs, whatever. Or it's the surfaces that you touch. Elevator buttons, doorknobs, the pen at the desk that people are using, etc. Those inanimate objects, non-living things that can hold virus for some short period of time are known as fomites, in case you ever hear that term. And then the other way it can spread is through droplets from infected people coughing or sneezing. Okay, droplets are, relatively speaking, heavy. They fall to the ground within a certain number of feet. 6 feet is generally viewed as safe. Yes, studies there, we think it might linger longer, etc. Most of those studies have not been reproduced in a meaningful way, and it's at odds with what we know about all these other respiratory virus droplet spreads. So let's not go too nuts here. There are things that do linger in the air a long time. Measles, right? This is one of the reasons we worry about measles. It spreads really, really quickly. Droplets, not so much. So that's where that 6 feet advice comes from. So again, this is how it spreads. It does not spread through other routes in a meaningful way. Yes, someone points out there's some evidence of fecal oral transmission. You should be washing your hands after using the bathroom or changing a kid's diaper, people, like in normal times, right? So yes, fecal oral, but come on, that really shouldn't be an issue here. These are the main ways how we worry about. Now, really important here, those viral particles need to enter you via your eyes, your nose, or your mouth. I want to say this again. Those viral particles, eyes, nose, and mouth, how they get into your body and infect you. Once more for people in the back, those viral particles need to enter your eyes, nose, or mouth. I'm emphasizing this because there's a lot of strange thinking about how these viral particles are going to get into you. Okay, if you have intact on your hands, which most of us, we're talking if you don't have gaping wounds, whatever, right? Gloves, actually touching a contaminated surface, you're not going to get any of this through intact skin. Now, if you touch your eyes, your nose, or your mouth with your contaminated hands or your contaminated gloves, okay, then you've given yourself potential virus. You've infected yourself, right? But there's a lot of kind of, we need to protect this, we need to cover this, we need to do all these sorts of things. It's like, okay, focus here. Eyes, nose, and mouth is the entry. And that's what we really need to focus on. Now, the other thing is people can be infected and therefore contagious for several days before having symptoms. This is true actually of almost all respiratory viruses. We've known this for ages, right? So this sort of, oh my goodness, this is this virus that you may not even know of it. Yeah, it happens all the time, folks. It's just that this virus is much more serious. They also may not develop symptoms at all, okay? Asymptomatic spread. So don't say, that irresponsible person, they came to work sick. They may have had zero symptoms. We are routinely infected by respiratory viruses that may not cause any symptoms, and we're shedding virus and never even know it. Okay? This is a normal thing. Again, but the stakes are higher with this virus. And the symptoms, quite annoyingly, I say this as a healthcare practitioner, are really not very specific and vary greatly in their intensity. Fever, cough, chest tightness. This is like so many other viruses, right? This isn't like, parvovirus or hand, foot, and mouth disease or something where I can look at a patient and say, oh yeah, I know what virus this is, right? Um, you come in with these symptoms. You could have a cold that's from one of these other viruses, or you could have COVID-19. Hard to really know. And that's really what's so challenging about all this. So really, really difficult to be able to tell from the symptoms because they really are so nonspecific. Now, I want to emphasize the most important thing is prevention. Yes, there's been so much talk about hospitals and ICU beds and ventilator capacity and all that. Prevention is the number one thing, and that's why we focus so much of it, and that's why we've really shut down so much of our society, is because there is no way we can get everyone through this in one piece, even if we had a gajillion ICU beds, right? Some people are still going to die. Prevention is the number one thing. So what do we have in our prevention arsenal going from best to worst? Most important thing, quarantine. And by quarantine, I mean you stay at home and you interact with virtually no one else or no one else, right? So people who have had diagnosed COVID-19, often they are staying in their bedroom. Their family is bringing their food on a tray and leaving it outside their door, and then they pull it in, right? Because they just don't want there to be any contact, right? That is what true quarantine is. You are isolating yourself 100%. You're not leaving your house. You may not even leave your room if you can help it, okay? That is the best way to prevent spread because none of those routes I talked about of contact are going to work when you are completely away from someone else. Next level down is self-isolation. This is what most of us are doing, right? We're staying mostly at home. We are staying away from other people. We are not going into other places, except when necessary, right? Quick grocery store runs, et cetera, et cetera, et cetera. Okay. That also reduces spread. You're nowhere near droplets. You're doing careful hand hygiene and all that when you're touching objects around, et cetera, et cetera. You're reducing your risk massively. Next level down would be social distancing, right? This is when you go somewhere and you're staying 6 feet apart, et cetera. Okay, yes, that's going to protect you from droplet spread, et cetera, et cetera. But again, you're out and about. Is everyone really doing the 6 feet? You still fomites, those contaminated objects, maybe an issue, et cetera, et cetera. But hey, better than like going and shaking hands, hugging people, all those sorts of things. Or having direct droplet spread from someone who suddenly coughs nearby you. Close with that is avoid touching your face. Okay, somebody could be spewing COVID all around me, but as long ignoring the droplet spread thing, if even if my hands get contaminated, if I can wash them with soap and water or hand sanitizer, okay, and if I can avoid touching my face, great, no problem. Okay, and that brings me why hand washing is so important. Simple soap and water, hand sanitizer will kill this virus. Okay. Yes, there's a couple of weird articles out there about, oh, does it really, whatever. Every other respiratory virus is killed easily by these things. And all the best evidence we have is that hand washing does work. I know it seems simple. I know it seems like, oh, it can't be that easy. Okay. But regular old soap, you don't get antibacterial necessarily or whatever. And plain old hand sanitizer does the job. Then we have face masks. Face masks keep droplets from spreading, or if there's droplets in the air, it reduces the risk that it gets into your respiratory tract. Okay, but you notice if you're 6 feet away from someone, you don't have to rely on that mask at all, right? This is why I'm putting masks down so far. People are fixating on masks. I do worry that things like masks people will get a little more casual. They'll get a little more lazy about the social distancing, about the hand washing, et cetera, because it sort of makes you feel like, oh, I'm protected. There's a shield here. Not so much. And if you have a mask on and you touch objects and your hands are contaminated and then you go adjust your mask, you've just contaminated the outside of your mask, right? So you got to be careful. And that brings me to gloves. Gloves drive me crazy. Why? Because when people wear gloves, they think that they're somehow protected. Remember, virus is not going to get through your skin. You need to touch your face in order to give yourself an infection. Or virus might be on your hands. Okay, you're touching other objects, you might contaminate those objects. That's where the hand washing comes in. Guess what? If you have gloves on, you're going to move virus around the same way you would on your hands. I saw a patient the other day in clinic, a young man. He came in wearing gloves and a mask and all that, right? And he's sitting there talking to me about why he's there, and he's using his gloved hand to kind of touch his face. And I'm sitting there just thinking, yeah, that's not how that works, right? You're, as soon as those gloves touch something, they're now considered contaminated. So I would not emphasize gloves unless there's a very specific, situation or case where you're handling like materials or whatever. We'll come to that. And by the way, the absolute best prevention, I left a space up there because I just want to highlight this, is a properly funded, functional, and well-heated health system. We don't need to be doing any of this to the extent we are if the public health system was properly funded and listened to early on. Okay, just want to make that point. All right, now let's get to the questions that people sent in when they registered, because that really helped me guide what to focus on and kind of lump things into kind of general themes and categories. All right, patrons, how do you get them in? How do you get them out? And so on. Numbers, how many people in my library? Guess what? I can't give you an answer to that. It's going to depend on your local authorities. It's going to depend on how much circulating virus there is. In Wisconsin, we've just been told, like no more than 5 people in an establishment. Okay, that makes for an awfully quiet library. Other places are going up to 10, 50, maybe 100. That's going to change. Your local authorities are going to really decide that for you. We have no data on exactly how many. And the question of how long is also we have no data on. I would argue that if you have a line of people wanting to come in, right, you want to kind of shorten the length of time that people are staying in your facility. Certainly, you can argue this both ways. If somebody's ill or somebody is shedding virus and they're in your library longer, they're spreading it more. But the more people you bring through, the higher the risk that someone who's unknowingly infected is there. You can drive yourself crazy thinking about this, right? So I don't have a great answer to you on that one. See what your local authorities say. Should we do temperature screenings? This is a hard one because fever is nonspecific. I would argue if someone has a true fever, they're infected with something, whether it's COVID-19 or something else, they probably shouldn't be there. At the same time, how much of a bottleneck does that cause? Is that intrusive? Is it private information to a certain extent? Um, I honestly think a large sign saying, if you have any signs or symptoms of illness, please do not come here, is probably a better move than investing in thermometers and screening people at doors, et cetera. Do keep in mind that not everyone with COVID-19 has a fever, right? So it's sort of this, is this actually changing anything? There's one piece of data I saw looking at the airport screenings, and they said, up to half of people who have COVID-19 may not actually have a fever. Okay, great. So is it really worth that kind of time and investment and trouble? I don't know. I'm going to say one other thing here, though. It may not prevent, keep people out that potentially are infected and spreading. Might it make your patrons feel like you're going to a good extent to protect them, right? Is there this sense of, okay, you really do care about my safety? That may be the case, right? And I think for a lot of these things, you may need to weigh, is this about confidence or is this about truly reducing spread? And I think both those things are valid, especially when we have such a frightened public. And that's going to depend on you locally and what people are thinking. Should you require masks of people? Again, look at your local authorities and their recommendations. Right now, nationally, we're being told when in public places, when you have to be in public places, do wear a face covering of some sort. So I don't think that's a bad thing. I think it's a good thing for your staff to do and model, and so on. When can we stop doing that? We don't know yet, right? When we're going to have to see what we're being told nationally. And then finally, people asked, what do we do when people don't want to follow the rules? They don't want to use hand sanitizer. They don't want to wear a mask, whatever the case may be, and so on. And by the way, don't make them wear gloves when they come in for all the reasons I mentioned before. But what do you do when they don't listen? You know what? Every single one of your libraries, schools, public, etc., have rules about what people can or can't do, right? Follow those rules. Follow the rules and follow the existing methods you have for any other type of non-compliance that you might have. Be kind, be compassionate, try to de-escalate whenever possible. But if you say our rule is that you must wear a face covering of some sort and someone says, I don't want to do that, okay, I would treat that as any other behavior that's specifically prohibited. Okay, and just stick to it and make sure that you're being backed up by your local authorities on that one. That's more sometimes I think of a PR issue than anything else. And then finally, people asked, what about a staged reopening? Do we open in pieces? I actually think that's a great idea, right? Start with something which is the most remote, right? So first of all, many of you folks may already be doing virtual services, right? You can do reference, readers advisory type things, whatever, helping people with ebooks, whatever, like completely virtually. Could you move next to like place holds and we will do curbside pickup, no one's coming in, no one's getting out of their vehicle or whatever the case may be. Okay, and then maybe later you open certain small areas. Yes, you could. Do we know what that staged reopening should look like? No, we don't. That's going to depend on, my goodness, all of your libraries have different sizes, shapes, capacities. Where do you even screen people when they come in? There's no way I can offer you any guidance on that. I think you'll have to do your best based on this information. But I think thinking about it in stages is actually a good way, and it helps everyone get used to feeling comfortable about the whole situation. All right, the desks, circulation, reference, etc. Sneeze guards, big plexiglass shields. I worked the election polls in April in Wisconsin in early part of the month, and they had built actually big plexiglass shields. We still wore masks behind them and all because droplets could get around. But again, if there's a shield right in front of you, that's going to make a difference. I do think it's a good idea for your staff to be wearing masks. Gloves, again, if you have hand sanitizer available right then, if somebody handles materials or a library cart or whatever and hands them back, does their thing and then immediately does hand hygiene, I don't know that gloves are going to be as necessary. If it makes someone feel better to wear gloves, fine, but that doesn't mean they can't do hand hygiene, right? They still need to keep that up. So I think explaining this to staff and letting them kind of weigh how things are going is just fine. Do you have to do sneeze guards? Not necessarily. Again, I'll tell you, look, in healthcare, what we've settled on largely for like regular old seeing patients in a clinic is a simple surgical face mask, not the really super tight fitting ones in all cases, the N95s, you don't need those, and a face shield. The face shield keeps the outside of the mask from getting contaminated so we can reuse them, and it protects my eyes. Do you need to go face shields? Well, sneeze guards are probably a little bit, kinder and nicer than kind of wearing a face shield sort of thing, and maybe a little easier on your staff throughout a long day and so on. So you could consider them, and they're pretty easy for most places to kind of make on their own, or you can purchase them. I think there's more places that are now offering those kind of plexiglass shields that you can mount or hang or whatever. They do need to be wiped down periodically. Hand sanitizer, yes, please. One of the best things you can do is to put hand sanitizer prominently in all sorts of locations. Ideally, one of those no-touch dispensers, put your hand underneath, a little infrared and, sensor, dispenses in your hand, because that makes it as easy as possible for your staff, for your patrons, et cetera, to come in and come out with their hands clean, okay? And in different places, next to high-touch places like the desks. I recognize hand sanitizer may be in short supply in some places. Do your best. What about handling materials? Again, intact skin and hands, not going to cause issues. Good hand hygiene. But again, if somebody's going to clean out the book drop, if you're receiving materials again, and they say, I want to put on gloves while I'm busy picking up all these books and moving them on to the next stage or cleaning them or whatever, okay, great. I have no problem with you doing gloves for that. Just don't have gloves on and then go and touch your face with the gloves still on. And you still should do hand hygiene after removing the gloves. Speaking of books, what do we do with these things? So I've actually researched this around children's books in clinic environments. I'm the medical director of Reach Out and Read Wisconsin, and I'm on the national board of Reach Out and Read, which does early literacy work with families through the regular checkups that kids get. So we think about this a lot. There was a lot of work on this actually being done in the library world. Yes, brought up at ALA meetings, et cetera, like way back in the turn of the last century, like late 1800s, early 1900s. What if books could carry infection? So they looked at a lot of these things. And then, of course, we got antibiotics and we got immunizations, so we stopped worrying about them quite as much. And now that question's coming back. So here's the thing. We don't have great data on this. There is one study showing how long does the COVID-19 virus specifically seem to live on different types of surfaces. Cardboard was 4 hours. And by extrapolation, you say, well, paper is and cardboard is a form of paper, 4 hours viability, because virus does not like to live outside of human hosts. It needs human hosts in order to reproduce and so on. So it does die off after a while. Other surfaces, 12 hours, 24 hours, 48 hours, right? There's all sorts of things. That's one study, okay? And it's all we have. So again, you may see different things out there. Also, the studies vary a little bit in a really confusing way. If all you're doing is swabbing and looking for evidence of viral RNA, right, the genetic material, well, that could have a virus that's incapable of infecting anyone. But if you can pick up and detect that RNA, people say, oh, look, it's infected, or there's potential for infection. It's a dead virus. It's not going to infect anyone, right? So unless you actually were to take swabs and then try to infect cells doing something called viral culture, you have no idea if that virus is actually viable. So again, be careful of these bad takes of, oh, we swabbed this and 14 days later there was still, viral RNA present. Well, yeah, duh, that's not surprising. But is it actually a threat? Not necessarily. So are viruses viable on books? We don't have a solid answer on that. What I will say is if you did nothing and there was virus on a book and you simply didn't touch it for some amount of time, eventually that virus is very likely to not be viable and be a non-issue. So then the question is, should we quarantine materials? You could. If you want to be relatively small c conservative, right? Like to say, we're going to, fine, take everything you're getting returned, stick them in a storeroom for 14 days, right? Some data will tell you 7 days, some data will tell you 72 hours, right? Again, we don't have a solid answer on this, but that's going to actually reduce how much viable virus is on anything, simply because it doesn't live, beyond a certain amount of time. Can you show that 0.01% of virus might still be viable at a week out? Or yes, you could, but that's a lot better than 100% of virus, right? Again, nothing is totally risk-free, nothing is absolute. What about cleaning? How should we clean books? Again, we don't have great studies on this. For many books, so in our children's hospital, one of the processes we were using for a long time was to use these cloths. They come in what looks like those baby wipe dispensers. These are called quaternary amine cloths, or quat cloths. A brand is like Sani cloth or things like that. There's a lot of different ones out there. And you take them and they're wet and you just wipe down the outside of the book. They work on surfaces like Mylar covers should be okay with that, and so on and so forth. Leave the book for 2 to 3 minutes, and then once it's dried, in theory, it's clean. We're using this on our keyboards in clinic. We're using it on the outside of our face shields, etc. Is that overkill? It may be overkill. Again, there's more out there. UV light. There are products you can buy that shine UV light, and in theory, that should actually kill viruses. I don't have good information on how long, how intense, etc. So reference the maker of these devices, etc. And by the way, some people have been going on about, well, sunlight, so if we just left things out in sunlight, yeah, please don't do that. We have no idea how much UV light is actually coming through. Is it a semi-cloudy day? Is it a completely clear day? Et cetera, for crying out loud. If you're going to use UV, please buy something that does it, and don't just rely on someone saying that UV light, just put it in sunlight and it'll be fine. Sunlight's great. Okay, let's use something that is a little more measurable and consistent. Okay, about curbside. It's almost like we're almost turning into fast food in many places, right? May I take your library order? How to best handle curbside pickup? Again, you need to think through what you can handle, what your physical layout is, etc. Some businesses have been doing this really nicely in many instances. Um, I could envision something. This is just a suggestion, right? You drive up, um, you show your library card through the window. You don't even need to roll down the window if you can do the scan through, right? Somebody brings out your books that you put on hold. You pop your trunk from inside the car, and somebody puts those in your trunk, closes the trunk, and you head on up. Okay, no touch, no contact, everything's shielded, etc. If you need to roll down the window to hand a card, whatever, okay, fine. Then you work that out, masks, etc. All those sorts of things. All of these are different options to think about how to do this sort of no-touch kind of pickup. I could envision a long line of people. How do you figure out how to get people's books out to them? Maybe you need an appointment system. Again, all those sorts of logistics. Any of those things are things that you'd have to work through based on your individual situations. What about homebound patrons? Again, for delivery, all the things we just talked about, making sure that you are, not touching their materials with contaminated hands. And do you take a page out of what food delivery has been doing, right? Drop the books off at the front door and then text, call, and say, "Hi, your books are at the front door. We've done a no-touch drop-off, or a sanitized drop-off, or whatever you want to call it. Pick up, have them leave the books when you come by. Again, if they open the door, wave at you from 6 feet plus away and put it out. There's nothing wrong with that. That's okay. And remember, many more people are going to consider themselves homebound because they are making a decision to not go out for whatever reason. And that's their decision, right? So we may be doing more and more of this in an effort to try to serve them. All right, how do you clean everything else? Rather than me go through a long laundry list that might change, I'm going to point you right to the CDC guidance on cleaning and disinfecting. All sorts of things there about what to use, how to use it, different surfaces, etc. Please go look at that. All right. And that means all these materials out there. What about our computers, makerspace, etc.? We talked about using the cloths to wipe down things, etc. Please look at the CDC guidance because again, that's going to be your best bet on all these sorts of things. Things that are potentially touched a lot, you had to decide what's your library's capacity to clean and clean and re-clean, multiple times. You may have to put some things away because it's just simply, you're going to be in a continuous cleaning cycle otherwise. Bathrooms. So here's the thing. You do not need to sanitize a bathroom after every single individual use. I just don't think that's practical. What I suggest is, again, hand sanitizer outside the door and maybe some signage guiding people. Here's the thing, signage guiding people about what to do may be one of the most important things you do in your library space, right? So if you decide you're running a circulation desk with patrons inside your library, X's, little taped X's on the floor about where people should stand 6 feet apart. That little guide helps people, helps them know, what am I supposed to do? I could see a sign outside a bathroom where it says, please sanitize your hands before entering the bathroom. Use the bathroom. Please do not touch your touch your face until after you have washed your hands with soap and water or hand sanitizer again. If you can, make sure that your bathrooms have doors that you can just do a little infrared sensor, swipe of the hand without touching anything. Water in your sinks where you put your hands underneath. All those sorts of things where, flush the toilet without having to touch anything. All those things will reduce the number of touches. Giving people guidance helps them know what to do. And then somebody asked, should we rearrange furniture to accommodate social distancing? Yes. Okay, until we're being told we don't need to do that as much, yes. So just remove the chairs, little signs, or if you can't remove a chair, put an X on tape saying accommodating social distancing. A lot of places are doing this right now in public areas, just to kind of say, hey folks, this is what we need. And that keeps your staff from having to enforce constantly because the signage is there. Most people want to do the right thing. Okay, children. Here's some realities about children. Children will touch many things. Children will touch their faces. Children will touch each other. This is developmentally normal, right? This is what kids do. And you just have to roll with it, right? I laugh when I see people giving advice saying, well, just make sure that children don't touch their faces unless they've washed their hands. And I'm watching a room of like toddlers and going, okay, you tell them to do that. Yeah. we got to be realistic here, right? So this is why children's areas, you're going to have to think really hard about, can you do any of this? Okay, because one question that came in is, how can we socially distance a class of young children in a small space? And my answer is, you don't, right? Maybe the children's areas are the last area to open. I want to be clear that children seem to be less dramatically affected by the physical effects of the virus, and more, there's far, far fewer deaths amongst children in any population in the world that we've seen. It's not to say it's zero, but you know, there's many more things that kill children than COVID-19. But children are a significant spreader through our society for all the reasons we just talked about on this slide. And we don't want them to get sick if we can help it too. So children's areas may need to be some of the things that stay virtual, that stay distanced for the longest period of time because of these realities. This is almost impossible to enforce in a meaningful way. So you're going to need to really think about that carefully. All right, some special populations. What about outreach? What about when you leave the library and go to a child care center, or to a nursing home and so on? You may choose in your library in general to have your staff do health screenings, right? To simply ask, have you had any symptoms? Have you taken your temperature? Blah, 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 all those things. If you're doing outreach to someplace else, I think health screenings become more important. Again, they're not a guarantee, but it's something. And if your staff says, yeah, actually, I have been feeling off, for crying out loud, send them home and please try to have a humane sick leave policy that doesn't penalize them for admitting that, yeah, maybe I don't feel so well. Okay, that's really important. If you're sending them places, especially things like nursing homes, a lot of vulnerable people there, make sure that they themselves have proper protective equipment to the staff, right? Really a mask more than anything else, but bringing their own hand sanitizer, et cetera, also just, it's good modeling. It's a good thing to be doing. And then how to do social distancing, right? And tell the location in advance. So a teacher in an early childhood setting can say to her, 10 kids, the librarian's coming again this week. It's been a while. They're coming now. They are not going to be able to sit close to you because we're all working very hard to keep everyone from being sick, right? So that way they don't run up to you, and they might still do that. They might forget, right? And fine, whatever. But advanced messaging on kind of what you're doing, how you're going to be doing it, all that really makes a difference. For the homeless, because we need to recognize for a lot of places, homeless populations use public libraries extensively. I would collaborate with your local authorities. A lot of them are trying to avoid putting people in shelters because of the close quarters. This is not physical space, and they're finding alternatives. I would work with them to say, okay, what can we do here, and how do we offer alternatives that those populations may not even know about, and so on. We want to be fair and equitable, but we also need to think about how long are they around for, what do you, and how do you handle where they need to be. Okay, so work with local authorities on that one, because I think everyone's going to have a different solution on that. Finally, a few things. Your staff, they need your kindness and understanding as well. Okay, OSHA has guidelines on preparing workplaces for COVID-19 in general, so please reference those. Okay, I think they're where we have this information, should certainly use it. Please listen to your staff. Okay, ask them what they're hearing. Ask them what worries them. Be as understanding and kind as possible. We all need this. I need this, right? From the people I work with and so on. Be flexible. Someone says, look, I'm happy to take reference questions over the phone from home because I just don't feel okay coming in. If you can make that happen, please do that. I can't tell you what to do or not do in your workplaces. I'm not an employment lawyer, okay? But then keep these things in mind and talk to HR with all these goals in mind, okay? And help them separate what they're hearing and what we know and all those sorts of things. We're all trying to do our best with something that we haven't really had to deal with for a very long time. Some closing thoughts. These might look familiar. Remember, nothing I said in this overrides local authorities or the CDC, really. There's a lot we know and a lot we don't know. Be comfortable with the uncertainty. I might not have said anything today that you don't already know or have heard, but hopefully I just confirmed that for you, okay? And what we know is changing very quickly, and may have already changed since I first showed you this slide just, about 45 minutes ago. So keep that in mind. Again, those well-vetted, reputable sources, please, double check things, click through, look at the study. And if you're not a librarian who deals with, say, scientific literature, etc., on a regular basis, reach out to your colleagues who do. Say, hey, what does this mean? I don't understand this, and I'm trying to figure out how to interpret this for us and also for our patrons. Okay, and then help your patrons with information literacy. Man, we really need you folks on that front in every single community out there. There's a lot of weird stuff out there. Remember, nothing's 100% safe ever, and we need to be calm, caring, and confident in our comprehension and our compassion for everyone. This is so, so deeply important right now, more than anything, because you know what? We're all in this together. And I want to remind you, so I write a column for one of our local newspapers, the Capital Times, and on a monthly basis. And I've written several columns on COVID-19 and coronavirus. And when all this first started to hit, the closings, the safer at home orders, all that, I thought, oh my goodness, is the public really going to do this? Are they going to give up the sporting events and their parties and socializing and restaurants and all that? You know what? Despite some very loud people out there, it's a really loud minority. Virtually everyone's doing this. They are doing this. We're banding together because one of the challenges with this virus is, on one hand, for an average individual, you're not going to get deeply ill. You're not going to end up in the hospital. You're not going to end up on a ventilator. Yet, for a population, there's an awful people for whom those are potential realities. These are two silly conflicting messages, right? The individual risk is probably small for many people, but there's a large chunk of the risk higher. And that is hard for people to get their heads around. That's why we're hearing so many worrying and saying, why are the hospitals not full? They said there'd be population health versus individual health. I live this all the time. My director, MD, Masters of Public Health program, individual public health care. When people said, yes, we're going to stay home. Yes, we're going to give things up. My son's a high school senior, right? He's got a formal graduation ceremony. He's not getting all these things, right? People are giving up all sorts of things because we recognize how this is. Honestly, it touched me. I said in a column at that when this ultimately is love. It's love for our fellow humans that we may not know nor ever meet. Love that careful being, their existence, and their contribution to our society. It makes me happy that these threats do not single out political affiliation, race, ethnicity, sex, religion, or immigration status. They are human endangering and require a human protecting response. When we protect all, we protect all. And I think it's really important to recognize that. I got to tell you, where public, school, health sciences, academic, whatever, the library ethos of what can we do to protect everyone? What can we do to build up everyone? What can we do to inform everyone is one of the most wonderful experiences of my life, was knowing that was there and hearing it reinforced in library school. You all do that, and you all do that so well. So thank you. Thank you for doing that work. And please continue that contribution, because there's a lot of people out there who will need our services, whether it's in healthcare or education or library service, out there over and over and over, whether you're serving students in school or whether you're serving the general public or anywhere else. You're important. We see you, and what you do does matter. If you want to read some of my ramblings, in the slides that will be accompanying this video online are these links to my so far 4 columns on COVID-19. I suspect there'll be more in the Capital Times, and you're welcome to look at those. And again, thank you to my friends at Demco for helping put this on, for doing all the infrastructure, the registration, et cetera. So many of you clearly were so interested. I will add, they've put up a page of trying to collate resources, items that may be useful to you in any of these kind of conversations that you're having. How do we implement this? If you don't already have some of these materials, it's a place to start in terms of thinking about all of these things. So with that, when we had the live webinar, we had some questions come in. So I'm going to switch off of my slides here for a moment and go to some of those questions that we did have come in live. So somebody asked about Mylar book jackets and whether that means they need to be quarantined longer than paper or cardboard. We don't know the answer to that. Mylar is more like a plastic than it is a paper. But again, you can wipe down the outside layers, at least with those quat clots that we talked about. And there's probably research going on. And again, look at what the CDC says about whether simply alcohol sprays or something like that might work. We also have to be careful we don't destroy all of our books in this process, obviously. Another question was about when kids coming back to school. How do school librarians manage kids coming in when they're browsing, etc.? Yeah, that's a tough one, okay? It depends partly. I would argue that school libraries, we need to think of them more like what classrooms are doing. So if schools have reopened, kids are all in classrooms, okay? Obviously, they're interacting with each other. It's really hard to do social distancing and all that. But schools may say, okay, we're going to reopen. You can interact within your classroom, but if you have, say, 2 fourth grade classes, those 2 fourth grade classes are not allowed to intermingle at all. Not at lunch, not on the playground, everything. Everyone, it's only as a class that you're going to do things. So maybe they only come to the library as a class. Okay, great. But then you have one group of kids coming in and then they leave. And then what about the next one? I think you need to think really hard about how you handle that. That's great. I love browsing in libraries, etc. Can you really wipe down all your shelves between classes? No, not really. Again, though, good hand reminders to not do face touching. Again, kids are kids. How much are they going to do that? But here's where compassion comes in. Somebody forgets to do hand hygiene. Somebody forgets a mask. Somebody makes a little lapse. It's not the end of the world. A kind, polite, gentle reminder will go a long way. We all need to be really kind with one another, including kids, patrons, others. You may need to decide to say we're not going to do browsing. Maybe kids are going to log on from their classroom and place holds. I realize that's not as satisfying as being able to browse a shelf, but maybe that's what they do. And then you guys do delivery or have them come to pick up. Every situation is going to be different. In a children's area in a public library, what about stuffed animals, blocks, games? When can we bring it back out? Going to depend on your local patterns. I think the more objects you have that may need cleaning, the more they're going to need to be put away, just again, staff time and so on. Stuffed animals, fabric probably isn't as bad as like a plastic block or something like that. But again, you need to use the principles, look at the CDC guidance on cleaning, etc. How do schools handle serving lunch to children and staff members? Do they need to eat at separate spots at their desks? Again, depends on what's happening in your community. A lot of places are doing 6-foot distancing minimum. At workplaces, again, desks may be reasonable as a way to do this, again, depending on your layout. Sometimes desks are very close by, and so on. Do lunches need to be done in classrooms? That's actually an option that many schools may be going to, just to say, we can't have everyone in a lunchroom. It's just not going to work. So they're getting creative in that way. Again, how long do you need to do that? It's going to depend locally. People are going to need to think hard about that. What about mobile library services and bookmobiles? Should they be suspended? Gosh, that was a hard one. On one hand, those are really confined spaces, right? So you can't have too many people in them and maintain distancing and droplets and all that sort of stuff. So you might not be able to have more than a couple of people, depending on the size, in there at once. And what do you do about that? That's a tough one. At the same time, bookmobiles and other mobile services are really lifelines for so many communities. People really need our libraries. I got to tell you, when we were in the early stages of the shutdown, while everyone was out there panic buying toilet paper, I was panic placing public library holds because I was afraid the libraries would close. And unlike toilet paper, I was right. 2 days later, the libraries closed locally. And of course, I support them closing. I get it. But still, libraries are important. So maybe you do something that's more open air if the weather's amenable right? Maybe you need to have people place holds and you bring it to them and you can't have them walking in. Maybe you take small portable carts and bring them outside with some good spacing, and so on. I think creatively. I want to add one other thing before I forget. This is also a great time for all of you, for the library community, to maybe try to collate innovations. What have you done that you wouldn't have done otherwise that actually worked pretty well? And what have you done that didn't work so well? We're actually doing this in Wisconsin on the pediatric side. We're asking our clinics, what have you done that actually is working really well as an innovation? And what have you, and maybe you want to continue in the future or use in some modified way? And what are you doing that you're like, oh boy, we would never do this again unless we absolutely have to? Because I think there's a lot of opportunities, like all of our telehealth and telemedicine type things are, you know, I don't think we can do everything on telemedicine, but I think some things may actually enable us to serve our patients better. Same with libraries. So take these opportunities to really think deeply about that. Should school hold in-person summer school and public libraries resume in-person programming for their summer reading programs? Depends on your local authorities. What are they saying about what's safe in terms of groups regathering, et cetera? That's going to matter. Depends also how you run your program in terms of laying things out and so forth. Do you expect to have everyone in one place, or is it something where you're able to do more things virtually, and so on? All depends on the nature of your programming. What are your thoughts on cleaning cloths, furniture, and carpet? Do they need to be disinfected? Um, Furniture, again, people's hands do touch it. Look at the CDC guidance on that. That's your best bet there. Carpet, if it's carpet that like kids are crawling on, that's a different story. Carpet that people are just walking on in general, not really. We track in all sorts of stuff all the time, and we're generally not touching the floor, so wouldn't worry about that too much. And then finally, should staff who are high risk or pregnant take extra precautions? So first of all, if someone is in a high risk category, yes, please do. And whether that means that they're doing extra masks, gloves, whatever, staying away from direct patron facing contact, student facing contact, working from home and helping in that way, sure. Pregnancy in general, we have not seen that pregnancy in and of itself is a risk factor, and we've not seen much evidence that fetuses are affected by this. And even newborns seem to not be deeply affected. It's more of again, a public health risk spread sort of thing, more than anything. Having said that, anyone who thinks that they are high risk from a health perspective, um, pregnancy, etc., please talk to your healthcare provider. Okay, they know your individual situation and they know how to judge that question and to provide you with guidance. And then that way, the library can decide as a workplace, what do we do with this individual, right? How do we keep them safe? What sort of modifications are necessary, right? That is a HR, workplace safety, individual health concern, because there is no way I can give you advice that would cover every possible scenario and situation. Everyone's different. And again, we're going to have patrons who consider themselves high risk and may still want virtual services, et cetera. I think we need to do the best we can to help them, recognizing that they may genuinely be at physical high risk, or they may simply be deeply anxious about going anywhere. And again, we need to work with all these folks. We need to be there for them because what we do is important to them. And I think we need to, again, do so with as much kindness as possible. So thank you so much to all the people who were interested in this. Thank you for the work you do in your communities. I'm sure there's more questions out there. Again, please talk to your local health authorities, ask them for guidance, and use the principles about how this is spread, about what we know, to guide yourselves when there is no specific guidance, because there aren't as many specifics as we all like to have. And again, thank you for what you do. It's really appreciated. Take care.